Okay, hello, Matt back with you here with another examination question. This was from an exam here at Bristol Grammar School. It was an Austro exam in January 24. And the subject is human performance and limitations. With a lot of these HPL questions, it revolves around a scenario and a lot of the answers are quite similar to each other. Quite difficult to break down exactly what's right and what's wrong. So let's have a quick read through it. It says, during a flight, the commander feels serious pain in the chest and left arm. Doesn't sound too good, does it? And the aircraft is approaching the top of descent. What's the correct action in this situation? So the first one talks about the commander telling the co-pilot that there's an issue and the co-pilot taking immediate action, getting first aid help. The second answer talks about the commander telling the co-pilot, but this time action only being taken if the situation gets worse. The third one says that the co-pilot's been trained for this kind of stuff, so no special action is necessary. And then the last one says, well, we want to avoid panic, so the commander will delay taking medical action until the aircraft is parked, as the flight is almost complete. Doesn't sound really too good, that last answer, does it? So I think we can probably discount that one already. But the other ones sound quite similar. So we have to be clear, as usual, what we're talking about here. And what we're talking about is a very important topic, pilot incapacitation. Now, of course, this comes in many forms. And the most common cause of pilot incapacitation, in fact, there is an exam question about this, is gastrointestinal upset. But it could also include problems with the ears. So maybe got an earache or blocked ear or something. Feeling faint. Headache is common, migraines. Also feeling of vertigo or general disorientation. Now the symptoms that they're talking about in the question here are potentially very serious, aren't they? They're cardiac issues which could worsen rapidly. So the point is something needs to be done, and it needs to be done quite quickly. Now, in fact, although death in the cockpit is pretty rare, it's nearly always due to cardiovascular disease and issues like outlined in the question there. There was a UKCA study done in 2004, and they found that the annual incapacitation rate to be about 0.25% of flights, so quite significant. But in those, cardiovascular conditions were the cause of approximately 50% of those recorded incapacitations, and obviously the risk of this increases with older flight crew. Okay, so let's have a look at incapacitation and incapacitation training. So incapacitation can be what we call subtle. So you're not really sure if there's a problem or not, or very obvious, as in this case, chest pain and pain in the left arm. Now, generally speaking, the way to approach this is that if you've had no response whatsoever to a communication between you and the other crew on 2 consecutive occasions, then you should probably be mentally preparing yourself for this kind of scenario. This is often referred to as the 2 communication rule. So that's asking 2 questions, no answer both times. But we should also look out for inappropriate responses to our verbal communications as well. Now, although a heart attack is obviously a very serious situation for the crew member concerned, it's probably one of the less hazardous incapacitations for the safety of the flight. Especially in this case, if maybe they're still conscious, what are you going to do in that situation? Well, every operator will have their own procedures to be followed in case of pilot incapacitation, but they will be quite similar in many respects, and of course they will conduct training in this as well. So it revolves around something like this. The first thing, of course, is to fly the aircraft. And in order for that to happen, there needs to be a formal handover. So the commander here, who's having trouble, needs to actually say, right, I'm handing over control to you because I'm not feeling well. Then the other pilot will need to declare an emergency. And it's important to actually declare an emergency and also be specific about it. Because unless you actually say, I have crew incapacitation and I am declaring a mayday, it's very easy for ATC to just think that there's a sick passenger on board, which is a very different thing. Also, you need to seek medical assistance. Now, often the cabin crew will have reasonably good medical training behind them, so they'll know what to do, at least in terms of first aid. And of course, you can also ask if there is a doctor on board. But you need to hand over the care of the other pilot to someone else, because you need to concentrate on flying the aircraft, of course. So the cabin crew will probably come in and they'll move the seat back and they'll semi-restrain the pilot. Maybe they need to move them somewhere where they'll be more comfortable, but that's something they need to deal with. You need to fly the aircraft. And then you need to consider the options. So what are we going to do next? Could well be a diversion. Okay, unless you're very close to landing already, then you've got to think about, well, I need to be on the ground as quickly as possible because this is a serious situation. As I say, move the incapacitated pilot back from the controls. Okay, now the general advice from ICAO, quite similar to what we're just talking about really, is 1, maintain control of the aircraft. 2, take care of the incapacitated crew member, giving that responsibility to the cabin crew. And then 3, reorganize the cockpit and bring the aircraft to a safe landing. That's your task then, isn't it? So looking at those available answers, which one matches what we've just been saying? Well, Alpha, Bravo, Charlie, quite similar in some respects, but the one that sort of stands out is Alpha, isn't it? The commander should inform the co-pilot, so that's that handover, so the co-pilot can take control, who has to take immediate action. And we've just outlined the kind of things you should have to do, and also ask for first aid personnel on board so they can hand over the responsibility. So Alpha it is. See you at the next one.